Screen Time Stories is presented by Pinwheel. Pinwheel gives kids and teens a smartphone experience that actually supports healthy development. I'm Julie, and as a parent, I know that embracing technology today is a must. Our kids will log on whether we like it or not. So let's lean into the challenges and joys of parenting with tech by learning from the latest research and experts in the field. This is Screen Time Stories, parenting techniques for raising tech natives. Let's figure this out together. Today's episode is a heavy topic, but important to share. We're going to go over the impact that screens have on our kids' mental health and the rise of suicides in youth. Because over the past decade, researchers have documented some disturbing trends. My goal today is to bring awareness to a subject that's hard to talk about, but hopefully by calling it out, we can spot patterns in our own kids and the kids in our communities, and we'll know how to help. I pulled a couple of studies to show where we're heading as a society, and I'll also talk to a children's psychologist at Stanford Medicine Children's Health named Dr. Bradley Zicherman. So some of these numbers I'm about to share are hard to digest, but please try because in 2020, the CDC named suicide as the second leading cause of death in 15 to 19-year-olds. Our kids have to worry about grades, meeting everyone's expectations, their romantic relationships, relationships with family and friends, the next steps that they'll take in their futures, political issues that they can't control, and lots of other stressors, coupled with early mornings and long days. Totaling all of this up, I can understand how our kids can come to face mental health disorders and worse. But despite all of their challenges, our kids still want to do their best, whatever that looks like to them. It's important for us as parents to help them get to where they hope to go. And to do this, we need to learn to see the warning signs of mental health disorders so that we can guide their healthy development. I want to make one more point before we talk to Dr. Zicherman. A 2018 longitudinal study on teenagers found links between depression, suicidal thoughts, and the increase in screen time, which all started to rise around 2010, making the researchers believe that smartphones create a negative impact. The same study showed that when a kid consumed over 5 hours of screen time per day, they were 71% more likely to have a risk factor for suicide. 5 hours seems like a lot, but this study includes quality media content, like schoolwork. Plus, the average American teen spends 7.5 hours on devices daily, according to a Common Sense census study. All right, let's talk to Dr. Zicherman now to hear about what he sees in the field every day and advice on supporting our kids.
Hi, Dr. Zicherman. Thank you so much for joining me today. Can you tell me a little bit about yourself?
Yeah, well, thanks for having me. So I am a psychiatrist. I did an adult psychiatry. I also did a child and adolescent psychiatry fellowship. I did an addiction psychiatry fellowship. I also did a forensic psychiatry fellowship. And I kind of parlayed all that experience into a career at Stanford, where I was brought in to develop what we've called the recovery clinic. And I typically see 13 to 17-year-old patients who might have addiction issues, either substance use or behavioral addiction type concerns like screen time, as well as co-occurring disorders. So patients who have an addiction component plus a mental health component like depression, anxiety, things like that. When I first came to Stanford and started the clinic, I thought that maybe 5 to 10% of patients I would see would be screen addiction related. And it's really closer to maybe 30, maybe even 40% of the patients that I see. The intakes are specifically for screen addiction. So I didn't realize how much of a need it would be to see these patients. And it's become a very large part of my clinical practice.
What does screen addiction mean to you in your practice?
Yeah. So there isn't really a DSM diagnosis for screen addiction. There probably should be at this point when they update the DSM. Who knows when they'll do that? But I look at the DSM, which is our sort of diagnostic manual, the criteria that we use to diagnose a substance use disorder, and I think you can really sort of use that same criteria for screen addictions. And I look at if someone's going to meet criteria for screen addiction, how is it, like, what are the impacts it's having in negative ways as far as functional impairment? Is someone's screen use leading to problems in school, in social aspects, relationships at home, or with other peers? Is it leading to problems with grades? Is it leading to problems with appetite, nutrition?
Yeah.
Is it leading to sleep problems? So that's a huge concern that comes up with most of the kids I see with screen addictions. So if I come across an adolescent patient in my clinic and a parent is worried about their child's screen use, and it seems like they have all these sort of functional impairments, then I will say I think they meet a criteria for, I think, what we can call screen addiction.
Okay. And then how does your clinic work? Is this something where your patients will come and stay overnight? Do they check in an hour a week for a session, or what's the norm there?
Yeah, it's a little different. So I have an outpatient clinic. I will do a what I try to make a pretty comprehensive assessment. I have up to 2.5, 3 hours usually when I conduct these evaluations. Sometimes I only see someone once, and it's more of a consultation, and I give parents advice about some brief strategies to manage their kids' screen addictions. Sometimes I will see patients for follow-up and focus on like behavioral therapeutic measures and strategies to help with those adolescents. Well, I'm calling adolescents because that's mostly what I see, but it could be younger kids as well.
What do you mean by younger kids?
Yeah, I mean, technically I could see kids who are as young as 5, but it tends to be mostly like a 13 to 17-year-old cohort, because most of the referrals I get, at least it's for the substance use component, and then it turns out a lot of times that, oh, my kid also has a screen addiction. So it just tends to work out that most of the kids I see are anywhere from 13 to 17, but I do see some younger kids as well.
Do you think, and this is just purely anecdotal, do you think that there's any causation, just based on what you've seen, between screen addiction and other issues that kids walk into the clinic for?
Yeah, so I don't think there's a single case where I've identified what we can call screen addiction. And they also haven't had a co-occurring mental health disorder diagnosis as well. So literally, I think every case I've seen over the past few years for screen addiction concerns, something along the lines of depression, anxiety, maybe bipolar, maybe PTSD, OCD. There's pretty much in every case I'm seeing an attached mental health component. This is sort of a new frontier in mental health. There's not a lot of great research data on treatment methodologies. Again, we don't even have it really as a DSM diagnosis. Right. So again, it's really new frontier, and that's one of the reasons why I enjoy it so much. I also, growing up, I played my fair share of video games. I know what that can do, and I also I see the profound impact that screen time can have on kids in the clinic. And if we can make a change, I think, I've seen some pretty impactful changes that have been made over the past few years.
So going back to your childhood, having some video gaming in there, I mean, same here. I think everybody in our generation and, prior, Atari was awesome. And then you had the Super Nintendo. What led you to getting into your field, going from point A to where you are now?
Yeah, I think it's something that I like talking about. If a kid brings up Minecraft or Roblox or other games you might find on a PS5 or an Xbox, like I can speak the language. I understand what these kids are talking about, and that's what we're just talking video games. I mean, it's only one component. I would argue that addictions to social media, constantly having to check your phone, are probably even more detrimental for mental health. But I enjoy language. I like talking about this. And I thought it was difficult. Like, I grew up before social media was a thing, and just had to deal with video games. I thought that was challenging enough, but now there's just so much technology stimulation around us that I feel sorry for kids that have to come up today. It's really something that I don't think kids are wired to be able to manage and regulate on their own in most cases.
And I do want to make sure we cover all of our bases, talking about, giving parents tools to help their kids manage and cope in everyday life. But that's the thing, is this technology that we're all dealing with, it's really integrated into part of our lives. It's practically a utility, as important as water and electricity. We need it. We're doing it right now. We're on a Zoom call where it's very important. I would not have a job if I didn't have access to the internet and all the wonderful pieces of technology. Do you feel like this type of access is more harmful than other types of, addictive substances like alcohol, drugs? There's all kinds of vices out there. Gambling. Do you feel like needing access to technology, in some cases, from what you've seen, can that be more harmful than a substance addiction?
I think in many cases, yes, a screen addiction can be as harmful as a substance addiction. You might not have like the neurotoxic effects that certain substances might have. But as far as the functional impairments that I see from screen addictions, absolutely. I mean, it can be as bad, if not worse, than being addicted to various substances.
Why is that?
Well, again, I think I have patients who imagine a case where you have let's say a 15-year-old teenager who they are on a screen for pretty much every waking hour, to a point where they're not going to bed until 6, 7 a.m. And then they have to make it to class at 8 o'clock, which they just can't do. Either that their parents might wake them up and drag them to school, and then they're sleeping the whole time, or they just can't really go to school. And then there's truancy issues, and then you're not sleeping, you're not eating properly, your self-care is going to be really poor. You're probably not going to shower and brush your teeth like you're supposed to. You're not interacting with peers and probably family, the way that someone should. I have cases like that. I have cases where, like I just described, I have teenagers who might be up until 5, 6, 7 in the morning every day when school's in session, and they're not able to go to school. Their diet, their appetite, nutrition is really problematic. They're isolating. They may be having very limited contact with parents. School achievement is really poor. Might start to feel really depressed. I get cases like I just described quite frequently, staying up until 6, 7 a.m. because they're addicted to technology. But I really see that, and I see it pretty frequently.
Oh, I know. Because my son is 13. I'm in there like, why are you still awake, man? Saying that it's tied to all these different things, I feel like it's almost, I mean, do you feel like there could be some kind of spiral effect involved where um, if I, personally, if I don't get a good night's sleep, my day is going to be just awful. I can't function right, and I might miss deadlines, or, things go wrong. But then it seems like the next day it builds on itself. Or even to take it back a step, maybe to cope with having a bad day because I wasn't properly equipped to handle everything that was going on. Maybe I stay up till 6 or 7 in the morning on my phone and I'm like texting, scrolling. So I feel like what I want to ask you, is it not just a repeating pattern, but do you think that it's something that could actually build on itself? And do you know what I'm trying to say? Just get worse and worse with each day that passes.
Well, that's often what happens with kids and teenagers who are going to school. School doesn't stop. Most kids have maybe 6, 7 classes at a time, and if they start to miss classes, school, because they can't get up out of bed or they just can't function because they're so tired, and yeah, it's going to build up and it's going to be hard to come back from that. The same scenario that I'm bringing up, most of those patients that are like that, they end up having to engage in summer school, where maybe not surprisingly, they do a lot better because maybe summer school is in the afternoon. They just have one class, and if they're still going to bed at 5 or 6 a.m., they might at least be able to get 6 or 7 hours still.
Yeah.
But then once school starts, it's a problem again.
Okay. I mean, and I my kid's school starts at 7:30, and I have such an issue with it because I feel like the data is very clear that kids should not be getting up that early, especially, all these kiddos that have after school activities and homework at night. I feel like they do need to have some free time to see friends.
You're right. 7:30 is far too early, and the data absolutely backs that up at this point.
Yeah. And so I can understand how a summer school class starting later in the afternoon, it's almost like a different topic, but so almost beside the point. Well, what do you think? How does that come together? If you have, like, why are they staying up all night? I guess that's what it comes down to. What are they doing? Why aren't they going to sleep?
It's stimulating. Whether you're playing a game or you're checking social media, you're actively using your brain. So it just makes it harder and harder to fall asleep. So that's a big reason for what's going on.
Yeah. Well, what do you say to parents of kids that are practicing this type of behavior?
Well, of course, you want them to completely stop it and reverse what they're doing. There definitely are some sort of standardized measures or strategies that I will discuss with parents and teenagers, usually the first time I see them. And it's, if you have a phone, if you're a teenager, you have a phone, don't charge it in your bedroom. The data suggests that you shouldn't be using any screens or technology really an hour, maybe even 2 hours before you go to bed. Of course, when I mention that to the teenager patient, they will usually roll their eyes at me, not surprisingly. And what I'll suggest is, if as a parent you want this to happen, you have to also model this behavior. And it turns out that most of the time when I get these referrals for screen addictions, it's a problem within the whole family. It's not just the teenager, it's also the parents who are having trouble setting limits for themselves.
Okay, so we need to do a self-check here before we start talking to our kids.
Yeah, I mean, that really is the case.
Yeah, because what do most people use their phones for at night? Like I'm trying to think of the healthy reasons, maybe just having the alarm in the morning. So
Well, so,
9 alarm
that
clock.
comes up, but that's not an excuse, right? Because you can just buy, an individual alarm.
Yeah.
I have to talk about that all the time.
Yeah.
Yeah, so there's no need to have to use your phone as an alarm.
Right. Okay. So I want to talk about a much heavier topic, because I've personally seen this on too many occasions. The rise of suicide in young kids. It's not something that I ever witnessed when I was young. And I don't know if my parents were just shielding me and keeping that information from me, because it was too heavy for a 10-year-old. But having kids that are 9 and 13, I'm seeing firsthand kids committing suicide, 10-year-olds. This is something that your clinic tries to address. Is that right?
Well, I definitely get patients who have oftentimes chronic suicidal thinking. Oftentimes, when I do an intake, it turns out that the patient may have had one, maybe multiple suicide attempts, and have had a history of hospitalization. So I do tend to see a rather high acuity patient population, and excessive social media, video gaming, if that alone as a variable leads to increased suicide rates, it might. It wouldn't surprise me if that's the case.
But like you were saying, there's just not that much research because this is such a new frontier from just the patients that you interact with firsthand and on a day-to-day basis. These patients that come in with suicidal claims or a history of attempt, do you feel like you're seeing more of that these days than there was 15 years ago? Do you feel like this is something that technology, overuse of screen time, is possibly contributing to?
Yeah, I think it probably is. It certainly is. The internet's easier to research ways that you can attempt suicide. It's easier to research ways to self-harm. When I was a kid, I didn't know what self-cutting was. Now I think with the internet, it probably, I'm just throwing out a number there. It wouldn't surprise me if maybe 80-90% of teenagers now and understanding that. And that's because, this information is just so much more readily disseminated.
Yeah, that's a really good point. I've never thought about that before because typically I'm all for kids researching and having, the internet to use as a positive tool. And so is it bad or good that kids are finding out about self-harm? Is it, could they learn about it and say, oh my God, I need to support my friend. I noticed these marks. Or is it something that could lead them to that kind of behavior in their own lives?
Yeah, I think that's a conundrum. And
yeah,
I think there's good and bad with that situation you described.
It's depressing.
Yeah, it's sobering. It is.
It is. No, that's an interesting thought. I just when I think of the steps that lead to suicide, I think, at least from the people I've talked to so far, it seems like as technology is related, there's other factors that people bring up. So that's interesting that you bring up the component of just learning that these different things exist. But, sometimes people will talk about, using technology as a way to numb or cope with external things going on. Do you ever see that in your patients?
Absolutely. I get reports from patients who might have frequent and chronic suicidal thinking that, well, my number one way of coping is to, look at my phone, browse the internet, look at social media. And what I would say to that is that might be your coping strategy, but it's a really poor coping strategy.
Why is that?
Well, because it's creating, a cascade of again, like a screen addiction where it's only going to make you feel likely more depressed, maybe more anxious. Someone who's depressed, who then is on their phone all the time, they're probably not engaging with their parents as much, their peers as much, not going to school. Again, they're not sleeping the way that they should be. So I would argue that it's just not a good coping strategy.
Yeah.
It might help in the moment. Not saying that it has to be completely shut off or completely changed, but I think someone in that situation needs to work in therapy on a pretty frequent basis to change those strategies and ways that they're coping.
Yeah. And, the podcast is all about giving parents the tools they need to help raise their kids as best as possible. But sometimes we have to make that call, right? To say, this is way over, I'm in over my head right now. When do we make the call? I want to get you set up with a therapist.
Yeah. Well, when it comes to screens, I think it's what I've been talking about, that idea of, it seems like there's functional impairment, sleep, eating, school, socialization. If there are problems with those issues, then that probably means that you should help to seek out a therapist for your kid. And it seems, even if it's not screen related, if you feel like your kid is really anxious or depressed, oftentimes a therapist is a good first step.
It's heartening to hear your perspective that it's like, go to therapy. You don't have to wait for your kid to start self-harming. Just if your kid is anxious or depressed, or like, just try it out and see if it helps.
It doesn't even necessarily have to be structured therapy. I think there's a real need for kids to, during summer months, go to sleepaway camps, sleepover camps. Be in nature. Do things that are almost, you have to sometimes, I think, in a way, force your kids to be in situations that aren't going to involve use of their screens.
Yeah.
I started this clinic 3 years ago. I ask very frequently, have you thought about sending your kid to summer camp? Not every situation is going to make sense, but it's a frequent question I ask. And say maybe like 5 patients in 3 years have gone to summer camp. And it used to be more of a thing. I was, at least I went to summer camp for 6 to 8 weeks every summer, and not where I was going to camp and coming home, but actually like sleeping at camp for 6 to 8 weeks, and things like that are important.
I hear you. I feel like it is a cost issue for a lot of families.
It certainly can.
And I'm wondering, what benefits does something like sleepaway camp offer that a parent could provide if cost was the factor in not sending their kid away?
Well, you're right. I think your cost is a factor. But if you're able to make it work, it's really worth it to think about something like that, almost as a tool at this point. But if you can't make that work, then I use the term pro-social behaviors all the time. And it's the idea of getting your kid in situations that are just not going to involve use of screens. I think it naturally, most kids who are, well, look, a kid who's addicted to a screen, like that, they're addicted, they like it. Like that's what they want to do. Like if you tell your kid, all right, hey, do you want to go to dinner? Do you want to go to tennis camp today? Whatever it might be, they're probably going to say no. So you have to provide them with a menu of options and say, okay, like these are things that you can pick from, and you're going to do one of these things. That you're going to do one of these camps over summer. Like there's no exception. Staying home and being on your computer is not an appropriate answer. Like it's not what you're going to be able to do. And unfortunately, I think I encounter a lot of families that either they're fearful to make a recommendation like that, or they just didn't see the importance of making recommendations the way that I just sort of described.
I get the importance piece, but I don't get the fearful piece. Why would somebody be fearful of giving their kid recommendations for activities outside the screen?
So I do see some patients with pretty notable behavioral challenges, and it does come up more frequently than you might even think. That a strategy that kids might use to get out of to continue gaming or using their screens the way they want is to say, look, if you take this away from me, I'm going to become suicidal.
Are they serious, or are they what? Like, if my kid says that to me, how do I handle that?
Yeah, I tell a parent, you always have to take their words seriously. The truth is, I think in a lot of cases, it is sort of a reaction, and they probably don't mean it. But I do tell parents, like, you have to take those words seriously, and there are certain safety protocols that technically, like, you need to follow if this comes up. But it is, I think, probably in most cases, and again, I think a lot of parents have trouble navigating that. Understandably, I mean, it's really hard to hear that your kid is saying that they're suicidal. But in general, I think whether it's voicing suicidal thoughts, or maybe it's less severe words that are coming out. I think if you start to implement measures, restrict screen use, if you feel like you need to do that at home, there likely will be what we call an extinction burst, meaning things will probably get worse at home before they start getting better. I think that's a really important point that I share with parents, that if you're looking to change rules or change the amount of screen time that your kid has access to, if you're thinking of using like an app blocker on a phone, on your teenager's phone, like there's going to be a reaction. They're going to be upset with you. They're going to be angry. But usually, if you are able to maintain those new strategies within a few weeks, then usually things will start to get better.
That's really good to know, because I feel like it's just good to brace yourself for the storm. Like I'm gonna, gather up my energy and put this app blocker on the phone, and we'll talk about it. And I'm gonna stick to my guns. It reminds me of, being in the grocery store with a toddler, and they're like, I want this chocolate. And no, it's 9 a.m. I'm not buying you chocolate. And so they throw a tantrum. Right. And so, we all know what happens when you give into the tantrum.
Yeah, don't be embarrassed as a parent to see that. I mean, it's you're going to be better off, not giving them that chocolate, not giving them that screen time, than giving into it, or else you're creating situations can be really, really untenable.
Okay, now give me an example, because I feel like this is, scary parenting territory here when we're talking about our toddler throwing a tantrum over chocolate, but instead it's our teenager having a bad reaction to us putting some kind of limitation or cap or app blocker on their cell phone. What should we, do you have any examples of seeing the backlash from some of your patients, or just a general?
Yeah, often a reaction, unfortunately, is the verbalization of suicidal thoughts. And that's a really scary territory for any parent to have to navigate. And I have to treat it seriously. We all have to treat it seriously. And if something like that happens, hospitalization might be needed. Sometimes I have to recommend it. And if that level of severity of behavior reaction continues, then that might mean that I actually would recommend a higher level of care, meaning maybe that means your kid needs to actually go to like a residential treatment facility.
Yeah. Okay. And I just want to have a very good handle on going from that point to
Yeah.
treatment facility. If my kid said any kind of, they verbalized any kind of suicidal thought, what steps should I take as a parent?
Well, if that happens, I would tell any parent, you can call 911, you can call crisis lines. You can actually take your kid to an emergency room. Those are all honestly appropriate interventions.
Okay.
At that point, your kid might end up being hospitalized if it turns out when they have their evaluation in the ER, for instance, that they actually continue to voice suicidal thoughts, and they might actually end up in the hospital. Which isn't, it's not the worst thing in the world. If they need it, they need it. But if it's a repetitive pattern, especially in relation to managing screen time, and if it seems like you just can't set any sort of limits, or that kind of reaction happens, then it might mean that you need to look into what we call like a residential treatment facility.
Okay. And so we talked a little bit about what we can do as parents to help our kids have better relationships with their technology. And, we talked about keeping the phone out of bedrooms at night. And that goes for the whole household, not just the kids, not just the teens. This is, me too.
Right.
Do you have any other good tips for parents to walk away with, ways to support their kids' well-being?
Yeah. So interventions, and you really need to start thinking about how you're going to manage screen time as a family from the time your kid is born. When you start approaching, age 15, 16, 17, it's going to be really hard to change behaviors. It can still be done, but it becomes really quite a challenge. And I think as a family, again, from the time that you have a child, you need to think about how you're going to manage screens, set limits. I don't like how the American Academy of Pediatrics, the recommendations is at this point is from the age of 5 onward, it's up to the parent essentially to decide how they're going to manage screen time for their kid. But I think you really need.
What's your opinion on that?
Well, I think they probably have that recommendation because there's just not enough data to issue a stronger recommendation as far as specific amount of time at this point. Like how many hours a day is actually would sort of qualify as a screen addiction. Like we don't have enough data to say that, but I do wish the language was a little stronger, that at least strong, like recommend strong consideration for setting limits.
Yeah.
I kind of wish that was in the recommendation, but I think you need to really think about how you're going to regulate and limit, set restrictions as a family on your child's screen use. They are just completely inundated this day and age in technology. It's everywhere. iPads, laptops, computers, TVs, social media, video games, VR technology, you name it, it's everywhere. And if you're able as a family to set limits from a young age, you're going to have more success as your kid grows up too. I don't think you necessarily have to not have screens in the home or not have your kid use the screen at all, but being able to say, okay, in elementary school, like when you come home from school, this is the designated hour that you have to use a screen, look at an iPad or watch TV. That's it. I think if you implement measures like that from a very young age, then it's an issue that you probably won't even really struggle with as your kid gets older.
And the reason that I just want to make sure I'm understanding you. The reason you say that we should implement this at a very young age is because it sounds like you're saying the backlash is something that we're trying to avoid. So having a teenager who's used to, you know, no, just total freedom on their phone, implementing some kind of, monitoring software that could lead to backlash. Whereas if you first give a kid their, setting up the pin on the TV, or the time limitations or whatever, when they first start to use that device or piece of technology, are you saying that's going to be a better scenario, better relationship with the kid and parent in the long run?
Oh, absolutely. And I just, the developing brain, it's not capable of setting its own limits with all of the stimulation that a kid has around them in this day and age. So I think it is really important for parent intervention. Well, parents at least be involved and set rules, and not just let their kids have unlimited, unrestricted access to screens. This is a really new challenge that we haven't had to confront, as human beings ever. But within the last few years, I guess you can say maybe 10 years, just the amount of technology that's around us. I think absolutely parents have to be involved, and they have to be able to help set limits for their kids, or else most kids are probably going to have some level of problematic screen use.
Yeah. And I am glad that you mentioned that our kids are physically not capable. Their brains aren't fully developed.
They're not. Your brain doesn't fully develop until you're 25, 26 years old. And that's the impulse sort of control area of your brain is one of the last to develop. And that's involved with making decisions as far as, okay, am I going to continue, looking at social media, gaming, or am I going to, do my homework?
Yeah. And, am I going to stop scrolling right now and do my homework? Am I going to stay up till 6 or 7 in the morning? It's just, a series of impulses at that point. Right. And
right.
Just poor decisions. And I don't think that we can put too much responsibility on our kids, knowing that their brains aren't fully developed. It's really on us as parents to be able to step in and give them the nudge they need to make better choices, so that their next day at school isn't just sleeping the day away.
Right. And it doesn't mean you have to be involved in every little micro aspect of your kid's life, but this is something that I think parents do need to be very involved with. Most of the cases that come to my practice for screen addictions, I get the impression that parents of those cases don't often have a lot of structure in the home. They don't have a history of setting a lot of limits, kind of letting their kids do really in a lot of ways what they want to do. And this day and age, it just doesn't quite work as far as screens go.
Yeah. And I just want to ask you, because sometimes it feels so good to throw routine out the window. Is there any benefit to acting like hippies and whoa, anything goes? Or in your opinion, is it all routine all the time, structure? Where's the...
No, yeah, not everything has to be structured. There certainly is a sort of happy medium, but I would say if you feel like your kid is their use of technology is starting to creep up more and more, you realize that their bedtime is starting to slip. Instead of going to bed at, let's say 11 o'clock, they're going to bed at 12:30, 1 a.m. now, and you realize they're just on their phone scrolling and texting friends, then that means, you need to be more strict about what's going on.
Mm-hmm.
And yeah, I think it doesn't have to rule every decision you make as a family and about, screen involvement, but I think it is just a really important consideration in this day and age that all families really need to think about.
Yeah. Yeah, that's good advice. Big takeaways that you want to share with us today. What kinds of things can our parents, our listeners walk away with?
Yeah, so start thinking about this when your kid's very young, really from the time that you start planning a family, I would say. Um, there's no like early point in time where it's too early to start really thinking about how you're going to handle screen use. You probably shouldn't be giving your baby an iPad almost as a pacifier. That's the start of really problematic behavior in time that your kid might be 2-3 months old. So this is a consideration from way back, when your kid is really born, that you have to start thinking about this. And if you do feel like you have a kid who they are becoming overly reliant on their screens, you feel like they are addicted to their screens and it's starting to impact their lives, there's help. It might be challenging to find, but that there is help out there. There are resources that can help from a therapeutic standpoint, even medication wise. Like I said earlier on, most of the kids I see, they end up having a diagnosable mental health condition like depression or anxiety. So, maybe they need to be managed from that standpoint as well to help reduce their screen time.
Yeah, no, that's a great point. I feel like, there's that possibility that they're over consuming because of other factors. And like earlier I asked if there's a causation between overconsumption of tech leading to mental health disorders like depression, anxiety. I feel like it could just as easily go in the other direction.
It does.
So if this tech overconsumption is leading to a rise in suicide among kids, is there research going on right now? Do you know of any studies?
Yeah, I mean, there's definitely more and more research going on as far as correlations with technology use and links to depression, anxiety, maybe suicide rates. Another thing that I point out is that I think it's really important that social media companies are transparent with their data. They know what's going on. They know when there's problems with use. You can look at what happened with Meta recently. Like, they have the best data, and it would be really helpful if academic researchers, independent researchers will be able to look at it to be able to assess really the best data that's out there. And we usually don't have access to it.
Well, that's depressing.
Well, it's an unfortunate reality, but maybe it can change.
I feel like your clinic is just on the cutting edge right now. And I just bless your heart for doing what you do every day. I appreciate it from a singular parent standpoint, but just as far as society in general is concerned, I feel like this is something we need to address. And I'm just very, I feel encouraged that you're going out there and doing this every day.
Well, I'm not going anywhere. I plan on this being a large portion of my practice for the foreseeable future.
Yeah, I have a feeling that tech is going to stick around for a little while.
It absolutely is.
Okay, thank you so much. I appreciate you meeting with me today.
Thanks for having me.
All right, parents. I know that this can seem daunting, because it is. But I think the worst thing we can do is pretend our kids are fine when they're not. Especially now that we all know the risk of suicide in kids is increasing at an alarming rate. If you do see behaviors or hear anything that makes you question your child's mental health, please don't wait to talk to their pediatrician. And if you're ever feeling that your child needs immediate help, take immediate action. You can dial 988 to call the National Suicide Prevention Lifeline. Let's make sure that we're setting a good example to our kids. We'll let them know when we're seeing a therapist. We'll put down our devices and look for activities to do as a family. We'll create spaces that make us and our families feel safe. We'll be empathetic. And the easiest one, that's often the hardest to put into action, we'll have fun together, even if it means the dishes stay dirty for one more day. Well, thank you so much for listening today. I really appreciate you sticking through this to the end and listening, trying to digest this entire difficult topic. It means a lot to our community. If you have any challenges with tech in your family, go ahead and send me an email at Julie, Julie @pinwheel.com, and I'll see if I can help you out. This episode was produced by me, and I will put out the last episode of season 2 next week. Take care.